What is the preferred clinical setting for optimal management of drug-drug interactions in patients receiving HCV DAAs?
So the question of how we manage drug-drug interactions has been, I think, one of the challenges that we've had to face. Prior to 2011 and the advent of the DAAs, we had pegylated interferon ribavirin, and there were hardly any drug interactions with those particular drugs. When we came in 2011 to telaprevir, boceprevir, we were suddenly hit with all these drug interactions. And the question is, how do we best manage patients? Is it the hepatologist, the gastroenterologist? Will it be primary healthcare? What about the involvement of pharmacists? What about the involvement of resources where we can find that information? And it has to be a team effort. But I would, from my perspective, and I come from the UK, one of the things we really do advocate is the involvement of pharmacists, because they have the time maybe to get the specialist information which is necessary for these drugs to be able to think about all the drug interactions and to think about all of the medications, because it's not only prescribed medications, it's over-the-counter medications, it may be recreational drug use, it may be herbal remedies. One has to think about every layer of what the patient may be taking. So it's a team effort. Clearly, hepatologists, gastroenterologists need to be very aware of the drug interactions and work with nurse practitioners and pharmacists, but also use online resources. And one of the things that we've developed from my own centre in Liverpool is an extensive online database which one can access and download from various apps in order to be able to get right at the fingertips, within 10 seconds, the information about a particular drug-drug interaction. So I think one has to look at a holistic approach for the management and think through exactly how one is going to. You can't hold your hands up and say, this is not an issue for me. You have to think about how, as a team, we're going to do this.